Hi, Dr. G here to discuss some tips when feeding your older infant in the 8 to 12 month range. Now, I personally feel this is a fun age. I love seeing my patients at this stage. However, for new parents, it can give some anxiety, especially when it pertains to nutrition with solids, knowing whether or not your infant is eating enough, whether or not they're taking too much. It just is an area of concern. So, first step is to take a deep breath. It is going to be okay. Let's use a couple of tips to keep in mind when you are thinking about feeding your little one at this stage to maybe help quell some of that anxiety. So the first thing to think about is calorie intake. How much do they need in a given day? That ranges from 750 calories to 900 calories, depending on the size of your infant. But that's a good range to think about. With that being said, the majority, more than 50% of those calories should still be coming from liquid calories, so either breast milk or formula. So it's less stressful knowing that they're still going to get the majority of their calories from something that they're used to having, which is breast milk or formula. A good gauge is about 24 ounces a day of either breast milk or formula. That'll give you around what they need in more of that 50% range for calories. Okay, not too bad, right? All right, tip number 2 is aiming for 3 meals and 2 snacks. And I use the word aim because you may not always reach that target, and it's okay, totally okay. So if you get in the habit of preparing kind of a breakfast, lunch, dinner with snacks, it does a couple of things. One, it facilitates that social development of mealtime for your child, which is important. It also introduces them to a variety of different textures and tastes. But what it also does is free up some of that anxiety. If they don't eat that great for the lunch that you give them, you know that they still have snack time, they still have dinner to get those calories in. So it's less stressful when you know that there are multiple areas or times they'll be offered solid foods. So again, it eases some of that stress. Okay, tip number 3 is serving size. Okay, let's think about what a serving size is for an infant at that age. And really, a serving size is either a 1/4 cup up to a 1/2 cup of whatever, yogurt or poultry or beans. And really, that's not too much. This is a 1/4 cup. This is not a lot. Okay, so if you think about having some shredded cheese or some beans in here, green beans, this is not that big, and this is doable, right? And so I think some of that stress comes from whether or not you're comparing what they're eating to what an older child or an adult's eating, and it's just not the same. Okay, so less stress again. Tip number 4 is going to be embracing the messiness of mealtime. It will be messy. It's going to be okay. Let them use their fingers. Let them smear it on their face and their hands and on the floor. That's all a part of development. They're able to practice that pincer grasp, which is super important for their development. And it also exposes them to different textures, which is also a part of the learning process and a part of the development, which is what we want as a parent, right? So I hope these tips are helpful for you in feeding your infant, and obviously this is just for educational purposes. You always want to touch base with your child's pediatrician regarding whether or not they are ready for solids, and also if you're facing any challenges when it comes to feeding your little one. I hope you found this helpful, and have a great day.